Welcome to today's Healthline webinar from the American Association of Kidney Patients, titled Infection Prevention Strategies for Dialysis Patients with a Central Venous Catheter. Thank you for joining us today. My name is Jerome Bailey. I'm the Director of Patient Engagement and Advocacy for AAKP. As the oldest and largest fully independent patient-led kidney patient organization in the U.S., AAKP is proud to host webinars as part of our mission to empower fellow kidney patients, family members and care partners, healthcare professionals, researchers, and policymakers. AAKP's Healthline and Healthline Innovative webinars fall under our Center for Patient Research and Education. We believe patient and care partner education is an integral part of an individual's treatment. And to that end, AAKP is a champion for full patient care choice, the protection of the patient-doctor relationship, and the elimination of artificial barriers and government determinants of health that impede patient care choice and access to available treatment options. At AAKP, we work to ensure that patients have a central role in the research and development process so that unmet needs are identified and unique patient insights and lived experiences fully inform innovation and the product development lifecycle. This includes clinical trials to regulatory action and payment decisions. Through our initiatives, we aim to ensure patients have a central voice in research and innovation by leveraging lived experiences and unique insights from the kidney community. We help drive meaningful advancements across the entire product development lifecycle, from clinical trials and regulatory processes to payment decisions. As medical science progresses with personalized medicine, cutting-edge technologies, and novel treatments, the potential for better outcomes in kidney care has never been greater. Patient safety has always been a cornerstone of AAKP's mission. Last year, we rolled out our National Safety Awareness and Public Education campaign titled Every Patient Safe. The multifaceted campaign focuses on the unique risks and unmet safety needs of vulnerable kidney patients and kidney transplant recipients. Those risks include ongoing susceptibility to serious COVID infection and premature death, increased vulnerability to healthcare-acquired infections, and catheter-related bloodstream infections among hemodialysis patients, future pandemics, and disruptions caused by sudden natural and unnatural disasters. AAKP has actively participated in initiatives aimed at preventing bloodstream infections in hemodialysis patients. These efforts bring together healthcare organizations, patient advocacy groups, industry leaders, and public health partners with a shared goal of enhancing infection prevention practices. Together, they provide evidence-based resources and tools to improve patient outcomes. To kick off today's program, I would like to introduce AAKP's Vice President and Chair of Policy and Global Affairs, Paul Conway. Paul is a passionate advocate for patient-centered care, patient participation in true shared decision-making, and the use of patient insights in kidney research. As a kidney disease patient himself for 47 years and a 28-year transplant recipient, he has been recognized for his advocacy work with several national awards, including the President's Medal from the American Society of Nephrology. Paul has served in 4 U.S. presidential administrations, including as Chief of Staff for the U.S. Department of Labor. He was selected by the FDA to serve as the inaugural chair of the FDA's Patient Engagement Advisory Committee and has served on the American Board of Internal Medicine Nephrology Specialty Board, as well as multiple CMS technical panels related to dialysis quality improvement measures. Before we begin today's program, we wanted to share survey insights gathered directly from individuals and their care partners related to their experience with central venous catheters, or CVCs. Through AAKP's Center for Patient Research and Education, we conducted a brief survey targeting infection awareness, infection occurrence, and innovation. Paul is here to share the results with us. Paul, the floor is yours.
Thank you very much, Jerome. And for those who are watching, we're very lucky at AAKP to have the talent of Jerome Bailey and so many other professionals that are dedicated to our mission and who have been with us for quite some time and know our patient population. What we'll do now is take a look at some of the information that we were able to gather from patients, and it won't be surprising to many of you. First, we wanted to make certain that we had a representative range of ages, as we especially focus on skilled nursing facilities and older populations in this year of making every patient safe. In the first slide, you can see this representation. We asked what type of access that folks have, and you can see here in a range the different types of access that people depend upon for life-saving dialysis. We're going to zero in on central venous catheter in particular, and the infection awareness, the incident rates, and the need for innovation. So we asked how confident people felt about yours or your loved one's ability to prevent infections and future infections related to dialysis treatment. And you can see here at the baseline, 60% are very confident, another 33% are somewhat confident, and then you have smaller ranges of not confident or unsure. The point of this is people who depend upon catheters are well aware of the fact that it has life-saving capacity and presents life-threatening illness that they have to manage and be responsible for. We asked how often do you or your loved one inspect your dialysis access point, whether that's a catheter, a fistula, or a graft, for signs of infection. And you can see again the diligence that patients have, 65% at baseline, a few times a week, once a week, kind of tiers like this. But again, this is an understanding that patients widely have of how important their access point is. We asked how comfortable folks are with the care and cleaning process of your or your loved one's access point during dialysis sessions. Again, very high numbers, but we're going to start to focus on somewhat comfortable and not comfortable here, which makes up nearly a third of those patients who are receiving care. We asked also how confident are you that the dialysis station is adequately disinfected to prevent practices. And at baseline, 61% were very confident. Somewhat confident, 31%. Not confident, 4%. So again, you're taking a look at a third of the population that feels not that confident, somewhat at risk. This is very important to understand given the implications for the population and for people if something goes wrong. We asked how often you or your loved one are reminded about the importance of infection prevention by your dialysis care team. So this is care teams reminding patients about how important it is to maintain hand hygiene and proper glove use. Always is 54%, sometimes is 26%, rarely is 15%, and never. We would assume there'd be a baseline of consistency for folks that are always reminded that. We were surprised at sometimes and rarely, which make up almost 41% of the population. So then we flipped it around and asked folks, do you actively remind your or your loved one's dialysis team about hand hygiene during dialysis sessions? And about a third of patients are proactive in reminding the teams, sometimes 13%, no, 23%, and no, I don't feel the need to is 32%. That can be a good number, the 32% no, I don't feel the need to, because they may not feel at risk. But if you take a look at the numbers here in the middle of sometimes and no, but I feel it's important, that again is a margin of error in our view of why patients and dialysis providers must work together to address the minimization of risk. We asked, have you or your loved one ever experienced any of the below healthcare associated infections, HAIs? And this is very telling to us because you see that in this population, nearly 30% have experienced a catheter-related bloodstream infection, 26% sepsis, 18% staph, and we had a smaller group that was unknown where they had experienced an infection, but they just may not recall or may not have the information on what type it was. We think this information, when you take a look at those strata of folks who don't feel confident and may not be asking or may not be regularly consulting with their dialysis teams on infection prevention, start to tell a story about ongoing risk for those patients receiving dialysis care, especially those that are dependent upon catheter-related access. And then we ask, practically speaking, from a patient's perspective and a caregiver's perspective, how can dialysis centers improve their infection prevention practices? Over half said if they're provided with greater choices and access to innovations that protect them during and after treatment, they would be interested in getting that and having that. More consistent hand hygiene for staff, nearly half said that. Clearer communications about risk and prevention, more frequent cleaning and disinfection. So you can see here there's a strong interest among patients for innovation and greater choice and maintaining the regimen and the vigilance against infection. And then we asked if a new medical innovation were available to you or your loved one to better help protect your dialysis catheter access and reduce the risk of life-threatening catheter-related bloodstream infection, would you want your or their dialysis center to provide that choice? And overwhelmingly, 83% said yes. That's the point of this discussion today. because we understand that patients are well aware of what their risk is. We know that patients are very diligent in doing everything they can and working with their teams to make certain that an infection doesn't happen to them. But it is a high risk endeavor when you're getting life saving dialysis care. And the point is not that no one's doing their job or anything like that. The point is that you got to drive towards where that margin of risk is, and you have to address it. And what our patients are clearly saying is that if there are innovations that are accessible and if they have choices, they would embrace those choices and it would help them narrow their risk of getting a life-threatening infection. Because as you could see, a third of our respondents had already gone through something that devastating. AAKP is dedicated to educating patients on their choices, preparing patients so that they can make that demand. Because to us, as we always say, kidney disease is both a healthcare and workforce issue. And we have so many patients that are trying to stay in the arena of life through either full-time work or part-time work. For those patients and all patients, and especially patients that live in skilled nursing facilities, we think that in the era of innovation, all patients should have access to innovations. They should be able to ask for them, and they should be able to get them because their life is on the line. Thank you very much. I'll throw it back over to my friend Jerome. Go right ahead, Jerome.
Thank you, Paul, for sharing those valuable insights. Hearing directly from patients and care partners highlight real world challenges faced by those receiving dialysis. These perspectives are crucial as we work to advance infection prevention practices and improve outcomes for the kidney community inside and outside the dialysis facility. Now to our first speaker. It's my pleasure to introduce Don Edwards, a home hemodialysis patient from New York and an AAKP national ambassador. Don has experienced every kidney replacement modality, including in-center hemodialysis, a kidney transplant, and rejection, giving her valuable insight into the diverse needs of kidney patients. She has dedicated over 20 years to advocacy and education through her work with the iPro ESRD network of New York, as a patient advocate for Next Stage Medical, and a wellness ambassador for the Rogerson Institute. Don is also the CEO of the New York State CKD Champions, a community based organization committed to educating, encouraging, and empowering local kidney patients. Her passion for improving the quality of life for those with kidney disease, especially in communities of color, is truly inspiring. Please join me in welcoming Ms. Edwards as she shares some of her experience of overcoming a serious infection.
Hi, Jerome.
Hey there,
Hello,
Don.
everyone.
So, my first question for you is, can you share your experience with developing a CRBSI, a catheter related bloodstream infection? What symptoms did you experience? How did your health team respond? And what kind of treatment did you receive?
Sure. My experience with the bloodstream infection is a little bit interesting. I'm a 35-year kidney patient, as Jerome said previously, and I have been using a catheter for um, over a decade. And I am a home hemodialysis patient, so I do my own catheter care. And I've been taught aseptic techniques since way back in the very beginning when I was doing peritoneal dialysis. So I'm very careful um, to use my aseptic techniques. However, back in April of last year, I noticed that I had a slight temperature, a little bit of chills. So I contacted my care team immediately and took cultures and they started me on a series of antibiotics. And after a while, we recultured and we found out that the infection wasn't going away. And I was still doing my dialysis treatments at home. And one day I went to set up my dialysis machine, and my mom noticed that I was completely confused. And she said, "Something's just not right here. I had been setting up my own dialysis for over 15 years. So she told me to get on the phone and talk to my care team immediately. So I called um, and let them know what was going on. And they told me to get to the emergency room immediately, where I was diagnosed with sepsis.
So, did this experience change your confidence about using a CVC for dialysis?
You know, I have no choice but to be confident in my utilization of a CVC. As a 35-year kidney patient, I've had um, fistulas, grafts, and now I'm using the catheter, and I'm out of real estate now. There's no place else to put a vascular access, so I have to be confident in the use of my catheter. So I have to be careful and I have to be confident.
Were there any infection prevention methods you were not aware of before the CRBSI?
Yeah, that's a great question. I'm always reading, and I read about a new innovation in catheter care, the DefenCath, which is antimicrobial um, cap for the catheter, and I found that to be interesting. And I also learned about the antimicrobial locks, where uh, the antibiotics is injected directly into the lumens of the catheter, and they're locked there. So, yeah, I did. I heard about some great new innovations.
You know, if dialysis patients were aware of an innovation that could help them avoid getting a life-threatening CRBSI in their CVC, do you think they would ask for it?
Heck yes. I think that there's no way for us, as much as we would like to, there's no way for us to really avoid catheters completely until science and technology comes up with a better or new way to access blood. So catheters are always going to be part of dialysis care, and I think that, the definition of insanity is doing the same thing over and over and expecting a different outcome. So, science, technology, we have to come up with new, innovative ways to provide catheter care. And I honestly believe that if patients knew about a new innovation or a way to keep themselves safe, and keep themselves healthy with a CVC, they would absolutely ask for it.
Thank you, Don, for sharing your perspective and experiences related to CRBSI. Next, please join me in welcoming AAKP Ambassador Michael Gilchrist, also known as the Caretaker. Michael is the dedicated care partner to his wife, Christina, who has undergone every dialysis modality and continues to live fully while managing kidney disease with a central venous catheter. Michael's role goes far beyond the typical duties of a care partner. His mission is to bring joy, laughter, and a can do spirit to Christina's journey. Together, they've turned what could be limitations into possibilities, doing dialysis everywhere from Washington, D.C. and Boston to the mountains, using a generator and even on a motorcycle. Michael's unwavering support and determination to help Christina live life on her own terms is truly inspiring. Michael, thank you for joining us today.
Thank you very much. And I just want to add that Christina is legally blind, so that's why I administer dialysis as well.
What were your biggest concerns when you first learned your wife, Christina, would be using a CVC for dialysis?
Well, we were used to peritoneal dialysis, so we were used to cleaning it, all that stuff. The biggest thing that concerned me was not at home, but when she had to go to a clinic or a hospital.
Have you and Christina received any specific education on preventing catheter-related bloodstream infections?
We actually insist on it, and that's something that I kind of push with patients is take your education and learn exactly what the technician is doing, what the nurse is doing, what the doctor is doing. Learn every single thing and how to handle your care yourself.
Now, has Christina ever experienced a CRBSI?
Luckily, knock on wood, or what we say, knock on filter, that she hasn't. But that is because we are extremely, extremely careful when it comes to a CVC.
Can you talk about some of the precautions that you both take to make sure she does not develop an infection?
Yeah, pretty much we just do the training that we were shown, and it's all those things of making sure there's no animals in the room when you're connecting, making sure the AC is off, and the only time that her CVC is open is the time that I'm connecting. And we're talking alcohol pad, move that out of the way, connect, put it back on. So we are extremely careful when it comes to connections.
Do you believe dialysis clinics should do more to educate and support patients and their families in infection prevention?
I absolutely do. I think with every infection, that is a prime time to introduce training as well, because I don't always feel that it's all the patient. You know, every single time there's an infection, education all around needs to happen.
And Michael, if patients had greater access to innovation to avoid getting a life threatening CRBSI in their CVC, do you think they and their care partners would demand it?
We don't only want to demand it, we want it. And I think CVCs get a bad rap because they'll everybody says they're prone to infection, and I totally agree that they can be prone to infection, but throughout the dialysis life of a patient, they're usually going to have every access. And show them how to take care of it, show them how how just to make sure that these infections don't happen, and if there is something out there, show it to us. We want it. We want the education on it. It's like washing your hands for 20 seconds opposed to 25 seconds. It's only better. So if there is something out there that can help with anything, we want it.
Thank you, Michael, for sharing your kidney journey with us today. We appreciate it. We've just heard from a patient and care partner about the critical importance of dialysis patient safety and the need for new innovations to protect those undergoing treatment, especially dialysis patients with CVCs. As I mentioned earlier, in 2024, AAKP launched its National Safety Awareness and Public Education campaign titled Every Patient Saved. A component of this initiative addresses the unique risks faced by America's highly vulnerable kidney patients and transplant recipients, including their heightened risks of healthcare acquired infections and catheter related bloodstream infections. Our next speaker is at the forefront of efforts to make dialysis safer. Her team has successfully brought to market the first FDA approved catheter lock solution proven to reduce incidence of catheter related bloodstream infections by an astounding 71%. It's my pleasure to introduce Liz Herbert, the Executive Vice President and Chief Clinical Strategy and Operations Officer for CorMedix. Liz is a dynamic and strategic leader in the pharmaceutical industry with 2 decades of experience across both academic research and industry settings. She has dedicated her career to building highly engaged teams and advancing clinical programs that bring innovative treatments to patients as efficiently as possible. Liz, thank you for joining us today.
Thanks, Jerome. It's so great to be here with you guys.
Great. So, Liz, AAKP's flash survey results clearly indicate that an overwhelming number of patients and care partners would want their dialysis center to offer new medical innovations that better protect dialysis catheter access and reduce the risk of life-threatening catheter-related bloodstream infections. How do you see the dialysis industry responding to this strong demand for innovation? And what challenges or opportunities do you think exist in making these advancements more widely accessible to patients?
Ooh, great question. So, first, I am so heartened to hear that patients want this access. And I think it's critical that patients understand when innovative products are available to him. This is where using patient voice with both the provider and the dialysis organization is so important. Educating yourself on innovative products and how they may be helpful to you is the first step, right? In my opinion, an educated consumer is the best consumer. Patients provide really valuable insights on what is important to them and what they need to help manage their disease. And those insights should be weaved into the treatment plans, especially for preventive measures where the patient is so actively involved in their care. Right? So, for example, patients receiving dialysis through a CVC know that keeping their line open for blood flow and free from infection is a shared goal between them and their provider. And the patients or their care partners take on a lot of those efforts, right? So, by not submerging the line in water, ensuring their dressings are clean, keeping the environment around them as clean as possible, and being really vigilant about signs and symptoms of a potential infection. So I think if they feel like they want an added layer of protection with access to innovative products, they have every right to ask for it and learn what needs to be done in their particular situation to gain access. There are multiple factors that go into this, right? Everything from does your dialysis center offer it? Does your insurance cover it? But by partnering with AAKP as one avenue, but really talking closely with their provider to say, this is what's important to me. These are my treatment goals. And how do we work together so that I can have access to innovative products and a treatment that I feel is best for my care? I think leveraging that patient voice is absolutely a necessary one. And it's not going to take one conversation. It may take multiple conversations. But I would say partner with the advocacy agencies, partner with your provider, and learn what tools are available to pave a path forward to ask those questions. And don't be afraid to ask for what you need to take care of yourself.
So we understand that DefenCath is an FDA-approved catheter lock solution proven to significantly reduce the incidence of catheter-related bloodstream infections. Can you tell us what makes this innovation unique and how it differs from status quo care some patients may be receiving?
Yeah, absolutely. It's one of my favorite things to talk about. So DefenCath is the first and only FDA-approved drug product to reduce the risk of incidence of catheter-related bloodstream infections in adult patients with kidney failure receiving chronic hemodialysis via a CVC. And look, there have been a number of efforts from institution-specific protocols to public health initiatives like the CDC's Scrub the Hub and Making Dialysis Safer Coalition that have been implemented in this vulnerable patient population. I think it's really important to take a minute to note and commend any institution or provider that is taking action to address this issue. This is very much an it takes a village mentality. DefenCath is different in a number of ways than other devices or solutions and can be really easily integrated into many of the established protocols for infection prevention. First, DefenCath contains taurolidine, which is a new chemical entity in the US. And taurolidine is a broad spectrum antimicrobial, not an antibiotic, and heparin, which most patients are familiar with. So, taurolidine in the concentration that is present in DefenCath does not have any known resistance to bacteria or fungi. And because it's not an antibiotic, it doesn't contribute to antimicrobial resistance, which is a big concern when there is misuse or overuse of antibiotics. So, bringing DefenCath to patients is a responsibility that we at CorMedix take very seriously. We don't want to cause alarm, but collectively, as a community, we have a responsibility to educate patients and providers on the serious risks of CRBSI and also to educate on all of the options that are available. DefenCath is the only drug on the market that has shown a 71% reduction in CRBSIs when compared to standard of care, and the only drug product to demonstrate its efficacy in a large-scale, double-blind, randomized clinical trial. So for status quo, many patients may be receiving heparin as a locking solution, which is critical to keep the line open and free from clots. But heparin does not have any infection prevention properties. And antimicrobial catheter caps have demonstrated protection for inside the catheter hub, but not the entire length of the lumen. And we know that bloodstream infections can happen anywhere along the length of the catheter and disrupting biofilm formation, right? If we think about biofilm, these sticky, slimy pockets of bacteria that band together and they create a polymer or a shell around them, and it's very difficult to penetrate those to treat them. We want to disrupt that as soon as possible, disrupt that biofilm formation. And DefenCath does that, right? It's very critical for impeding the infectious process. So from a public health standpoint and in an effort to ensure that we are working closely with dialysis providers to greatly improve patient safety and outcomes, we're really committed to DefenCath becoming the standard of care for dialysis patients on a CVC.
And how can patients learn if this technology is an option for them at their place of treatment or for other patients they know?
Sure. So we have entered into supply agreements with 4 out of the 5 largest dialysis providers, as well as many institutions and smaller dialysis organizations throughout the country. And those numbers are growing every day. And we are really working diligently with all of our partners to ensure that DefenCath is available to patients throughout their facilities before the end of the year. Each dialysis provider does have unique plans for implementation. So it's important for patients to realize that as a new technology, DefenCath may not be available to everyone on day one, but there are plans in the works. And we are really heartened at the position that these leading dialysis providers have taken when it comes to embracing a proven technology and improving patient outcomes. So I really encourage patients to ask their clinician specifically about access to DefenCath and to work with AAKP on how to have those conversations, because sometimes it can be a little intimidating, but I know you guys will support them well.
Absolutely. Now, life-saving innovations are of tremendous interest to vulnerable kidney patients and their families. From your perspective, how important is it for patients to engage with their kidney care professionals and actively discuss all available cure choices on which treatment works best for their needs?
Sure. So I personally believe that kidney care professionals are a really special kind of provider. Unlike many other specialties, I think we all know that there's not a lot of glamour in kidney care, and the need to fight for what is best for your patients is paramount. What we see in other disease states, innovation, maximum patient agency, equitable access to proven therapies, and more personalized healthcare is not something that we can assume or take for granted in the hemodialysis space. We need a significant reform in everything from policies to patient care models to get on an equal playing field. an observation I've had through the years is how little voice is inherent in the dialysis patient care model. And I think the work that AAKP is doing is critical for driving that change. And quite frankly, it's long overdue. Many dialysis providers are working to change the way patients engage in their own care. And I think that we need to jump onto those initiatives as well. I would say it's imperative that while dialysis may be necessary for patients, that collectively as a community, we shift it from something being done to the patient to something being done for the patient and with the patient. Autonomy and agency comes from being informed and exercising those choices for treatment modalities, for choice of healthcare provider, for choice of dialysis provider, and health plans and medications. And sometimes in the dialysis world, patients haven't had the opportunity to flex that muscle when it comes to agency and choice as much as they should. So I encourage patients to really embrace the term patient consumer, taking the time to prepare questions for your care team, being open and transparent about what is working for you and what's not, what's really important in your treatment goals and why, right? And bringing a support person as a second set of ears and communicating what you're looking for are not only patient rights, but those are the change agents that we need to start co-creating care plans.
Now, during the webinar registration process, attendees were provided with the opportunity to submit a question. AAKP has collected a few of those questions that I'd now like to pose to you.
Sure.
First question is, this person says they are curious to the availability of DefenCath in outpatient clinics for her patients. Have these been compared to ClearGuard HD caps? Are you able to share any real-world outcomes regarding DefenCath's use in terms of hospitalization or mortality benefits?
Ooh, okay. So great question. So as I mentioned earlier, CorMedix has entered into agreements with 4 out of the 5 leading dialysis providers. As a TDAPA product, the implementation of DefenCath can take a bit longer than other types of drugs. So I would say be patient with your dialysis organization as it's coming online. With respect to ClearGuard caps, which is a medical device, right? They are not a drug product. We don't believe that they should be perceived to be a competitor with DefenCath. There are numerous mitigation strategies for reducing infection risk, and we view antimicrobial catheter caps as being complementary with DefenCath, as DefenCath is an antimicrobial locking solution. To that extent, though, we haven't run a competitive study against antimicrobial caps, but we have confirmed chemical compatibility. So they could be used together if somebody chose to do that. DefenCath has been added also to a number of hospital formularies, and there are a number of real-world evidence initiatives that are underway. So we look forward to publishing that data when it's available, but we haven't been on the market very long, so that data is not available yet, but coming soon for sure.
Another question is, how can we decrease our catheter infections in our unit?
Sure, that's a really important question. And again, I think this is where the it takes a village mentality really comes into play. I think it's also important to share that most dialysis providers, certainly the ones we're engaging with, have really rigorous infection prevention protocols in place to keep their patients safe. The nurses and techs are trained on these, and they share the same commitment that CorMedix has to reduce as many infections as we can. That being said, despite the availability of all of these mitigation techniques, such as antimicrobial caps, CRBSIs continue to plague the HD CVC community, and what's being done may not be enough. Using proper hand hygiene, scrubbing the hub of the catheter, ensuring the exit site is clean, and regularly changing dressings are all proven ways to reduce the incidence of CRBSI. But in addition to those measures, the use of an antimicrobial catheter lock solution like DefenCath that's been proven to reduce the risk of infection, even when all of these measures are in place and adhered to, might be appropriate. So if your unit is exploring options to reduce their infection rate, DefenCath may be a great option to support those efforts.
And another question we received is, what is the current practice related to heparin anticoagulant use, and what is left in the catheter post-dialysis?
Oh, sure. So, heparin, which is an anticoagulant or a drug that works to prevent clotting, is used in a couple of different ways. So, heparin is given to keep the dialysis circuits open, which allows for efficient dialysis treatment and to prevent clotting during dialysis. And in many cases, heparin can also be used to lock the line. So that means that when the dialysis session is over, the nurse or tech will instill heparin into each lumen of the catheter to keep the lines patent or free from clots in between dialysis sessions. And while that's great from an anti-clot standpoint, heparin doesn't have any antimicrobial properties in it, meaning it doesn't kill bacteria or fungi. So if heparin isn't being used, it's possible that your unit is instilling other solutions into the catheter, saline, sodium citrate, or some compounded solution that may be made in the pharmacy. So the main takeaway really is that anything placed in the catheter lines is there so that it should work to both prevent infections and keep the blood flowing well. And those solutions will stay in between dialysis sessions, and then the nurse or tech will aspirate them out prior to your next dialysis session.
That is all the time we have for questions. Liz, thank you so much for your responses and for joining us today.
Thanks so much for having me. Always great to be with you guys.
Bye-bye. And a big thank you to Don and Michael as well. If anyone watching has additional questions for our speakers or about today's webinar that we were unable to get to, please email us at info@aakp.org, noting the webinar title in the email subject line. Before we close, I'd like to encourage everyone to visit the AAKP's Infection Prevention in Kidney Disease Patient Education webpage. This webpage has a wealth of important information and also includes additional downloadable resources such as AAKP's Pocket Guide brochure on managing infection risks for dialysis patients, on-demand content, patient profile articles, and access to AAKP's Emergency Preparedness webpage. We encourage you to stay engaged in our Every Patient Safe campaign by sharing our resources and participating in future infection prevention and emergency preparedness programs. In closing, if you are not already a member of AAKP, we encourage you to join. AAKP offers free membership to patients and family members, as well as living kidney donors. To become a free member, join online at aakp.org/join or by phone at 1-800-749-2257. To receive all the benefits of membership, please be sure to include your email address when signing up. As a member of AAKP, you will be notified about all of AAKP's upcoming events, the latest in our educational program series, and when opportunities arise where your opinions and experiences are needed to help inform innovation, advance care, and make a meaningful impact to improve lives. We encourage you to respond to our flash surveys and other engagement opportunities to help us elevate the independent patient voice and change status quo kidney care. You will also receive a digital subscription to our bi-monthly magazine, AAKP Renal Life, and can select to receive any of our 5 different electronic newsletters, all for just signing up. We also invite you to check out our blog to read some great articles and patient profile stories, and follow us on social media for all the latest news and to keep up on what's trending. AAKP is dedicated to helping kidney patients across the disease spectrum understand their condition and take control of their health care. We are proud to offer a variety of resources for both patients and care partners. By visiting our webpage at aakp.org and clicking on the AAKP store button at the top of the homepage, you can find a variety of educational brochures and online tools to order or download free of charge, including such titles as the Understanding Your Hemodialysis Access Options brochure or the Conversation Starter Questions to Ask Your Healthcare Team About Choosing the Right Therapy for You. You can also order materials by phone. We are excited to announce the dates of our 2025 events. The AAKP National Kidney Patient Advocacy Day will take place on March 12th, 2025. This is a virtual event that will allow AAKP members to talk to congressional members and their staff about legislative issues and policies that are important to kidney patients and their families. Follow us on social media on March 12th to get engaged from the comfort of your home or office. The 7th Annual Global Summit on Kidney Disease Innovation, hosted by AAKP in partnership with the George Washington University School of Medicine and Health Sciences, will take place virtually May 22nd and 23rd. Registration is now open. The 8th Annual Public Policy Summit will be held in June 27th. This year's event is hybrid, with the in-person component taking place at the National Press Club in Washington, D.C., as well as a virtual option. And the 50th AAKP National Patient Meeting will also be a hybrid event taking place October 3rd through the 5th. Stay tuned for details as a location will be announced soon. Finally, you can visit our YouTube channel to watch a number of great presentations and webinars, all available on demand from our 2024 events and programs, as well as the 2025 programs as they occur. We would like to once again extend a heartfelt thank you to our webinar speakers, AAKP Vice President Paul Conway, Don Edwards, Michael Gilchrist, and Liz Herbert for graciously participating in today's Healthline event. Their expertise and insights greatly enriched the discussion and provided valuable information. And thank you to everyone who joined us.